Hello everyone, and welcome to our program today. My name is Russ Browder, and I'm a marketing manager at GE Healthcare. I will be your host today for this webinar, Beyond Meaningful Use with Centricity Practice Solution. We're very excited to have hundreds of you joining us today. We have a mix of both current Centricity customers and some who may be interested to become future customers as well. As we get started, I just want to mention a few things for you about the logistics of today's program. We will leave some time at the end of the program for questions and answers with our speakers today. So feel free to submit your questions at any time throughout the program using the chat feature on the right-hand side of your screen. You'll see it over there on the right, and just type in your question as they come to mind. We will do our best to cover as many of those questions in the time remaining in this one-hour-long program today. I would also like to mention that today's presentation is being recorded, and we will make a copy of the presentation available to you online via email in the coming days. So please be looking for that email with the link to the recording. So as we get started, I'd like to introduce the two speakers that we have lined up today. Our topic is going beyond meaningful use with Centricity Practice Solution, and Joanne Kern will kick us off and give an introduction to really set the stage for how you can be prepared to accomplish meaningful use with Centricity Practice Solution. Joanne is our Marketing Director for Electronic Medical Records at GE Healthcare. She's a nurse by background, and she's responsible for our product strategy and direction within our electronic medical records. So Joanne will give a great introduction to set the stage. Team will give a demonstration of Centricity Practice Solution and walk you through the application itself. Kathy is a member of our team, and she has also been very active in our certification team to help get certification for Centricity Practice Solution as well. So with that, I want to welcome Joanne and Kathy to the program. And Joanne, I will hand you over.
Thank you, Chris, and welcome everybody. Thrilled to see some of you joining us today. A great webinar. I think that have been involved in care delivery. So I thought I'd just precede Kathy's great demonstration with just a little bit of background for all of us to get grounded on where where meaningful use is and where it's headed. I think many of you are following this evolution of the meaningful use measures have come out in this year. There is that evolution that's taking place over the next several years, basically formulated into three stages. Focused on the capture and collection of data, and also the sharing of that data across different data exchange methodologies. Moving into stage two, then, we're really talking about focusing on advanced clinical processes and continuing to capture that information in care delivery processes. And then moving into the third and final stage of meaningful use over the next few years, stage three will be very much focused on improving the outcomes of the care that is delivered. So it's interesting to see how things evolve over time with the different stages. We're very much focused on meaningful use stage one right now. What you'll be hearing about today is mostly about positions you to meet those criteria. But it's important to think that over the evolution of these stages as we go forward, meaningful use is really about not just the incentives, but really about using technology to transform the way we all deliver care, to really be able to provide those meaningful and measurable outcomes, and to give us all a platform upon which we can collect similar information and share that for the betterment of our patients. And here with the GE solutions, with Centricity Practice Solutions specifically, it's very much in alignment with where we have focused our product efforts around really giving you as our customers the information that you need at the center of care so that you can make the right decisions on an ongoing basis, and really helping you manage all of this complicated data that you capture and turn it into information that can really give you insight into the decisions that you do make. continue to focus on the 5 key policy areas as we go through. So with every stage, stage 1, stage 2, stage 3, there will be meaningful use readiness criteria that will accommodate each of those 5 policy areas of focus that the ONC has identified. And those 5 overarching meaningful use themes really are the ability to improve the quality, safety, and efficiency of the care that we're all delivering, being able to engage the patients and family in the care so that they're active participants in that care process, improving the way that we manage the movement of patients through different silos of care and breaking down those silos of care through better care coordination, improving the way that we manage the populations of patients that we take care of in public health through immunization registries and population management tools, privacy and security regulations to make sure that our patient information is collected but is also stored securely and safely. And each of these 5 areas, again, for us with the Centricity Practice Solution, we're thrilled that we're focusing on these 5 areas. They're areas that we've done quite a bit of work on in the past, and as we roll out toward varying additional stages of meaningful use, we'll be devoting a lot more of our resources and making sure that you have all the tools you need to meet the criteria in each of those 5 key areas. So a comprehensive meaningful use package to you really is about how do we pull together the right set of tools and technologies so that you can hit each of the criteria that you need to in those 5 key areas. So our commitment to you with Centricity Practice Solution is to provide you with those IT tools and services that you also need. And again, meaningful use is about transforming care. So there's quite a bit of the criteria that, yes, are based on the technology used, but there's also some process change and practice organizational change that is up for consideration with this as well. So we do have some additional services to try to support your quest in that realm as well. Advanced e-prescribing, all of our clinical messaging suites, the patient portal activities, our quality reporting services, and we'll touch on a lot of these in more detail, all the way down to interface engines and immunization registries and all of the different rich clinical content that we can bring to bear in the interfaces that we provide really give you that core set of technology tools that you need to have in order to continue to move towards your meaningful use goals. And again, on top of that and underpinning that are some of the additional professional services around education and training, our rich set of customer support tools and our support teams. And Russ will mention this here at the end of our call as well, some of the meaningful use of steps determine whether or not your practice is ready, how ready you are, and if you aren't quite ready, what are the steps that you need to take to really formulate your action items. So that's really, in our mind, how we pull together the right set of technology and services that you need to give you that comprehensive, meaningful use package. So the meaningful use incentives and how you can actually gain those incentives for using Centricity Practice Solution really requires you to do a handful of key things. And it's worth bearing in mind and continuing to repeat what some of those key things are that you need to think about in your practice as you're getting ready to be prepared to meet your meaningful use goals. One thing that you want to think about right out of the gate, whether you're a current user or a customer that may become a new customer here sometime soon, is to start to think right now and work within your practice setting on identifying any of the objectives around quality, identify what your plan is to meet those. The Meaningful Use Readiness Assessment is a great way to do that, and also just getting familiar with some of the criteria. We'll provide you with some links to further information to the details as well. But you do want to start to think early on in your process about what measures are important to you, what measures you're mandated to collect, and which ones you're choosing to collect, and what's your plan to start to collect those. Another key thing to remember is that the meaningful use incentives require that you use Centricity Practice Solutions with a meaningful manner in mind, meeting the criteria that's specified for at least 90 days in the first year, starting in 2011, and then for the full 12 months years after that. So it is optional for you to begin your meaningful use period in 2012. But you can also start in 2011. It's just important to remember that you need to be able to document that you were using your EMR in a meaningful manner for 90 days within that first year, and then your second year you pick up needing to be able to show that you have used your EMR for the full 12 months. Another thing to consider if you're an existing customer or someone who's going to become a customer soon is to really look into GE's Medical Quality Improvement Consortium, or MQIC, MQIC we call it sometimes, which is another way of being able to collect and measure lots of different quality management metrics, but the meaningful use metrics as well. So our MQIC data warehouse actually gives our customers a great opportunity to be able to collate and aggregate their data and report against it with a series of very nice tools, and we'll touch on that a little bit later as well. And lastly, just around submitting those criteria and reports as well, it's important to remember that you will be asked as part of the Meaningful Use Program. In the year of 2011, they have proposed that that be done through self-attestation. So we're anticipating there being a website, as there have been with other similar CMS programs in the past, that allows you to go and just articulate that, yes, I did meet or not meet certain criteria. In 2012, what the ONC has identified is that they would then enable electronic reporting for those quality measurements directly from the technology itself. And again, we're thrilled with Centricity Practice Solutions to have a long history of reporting PQRI and other types of electronic submission to CMS for other different types of pay-for-performance programs as well. So we're looking forward to being able to facilitate that reporting process as you collect and gather that data within your EMR. So the road to meaningful use really has been a little bit of a winding path for those of you that have been watching this over the last year. There's no shortage of changes along the road for sure. The final steps for ONC and CMS criteria really fell into place this past fall when they released one of the last remaining open issues around the actual certification process. So starting in the spring and summer when interim criteria were released and then more finalized version of the specific measurements were released in the summer, all the way up to the fall time frame when the actual certification process was landed upon. It's been a winding road, but it's pretty clear now exactly what the path is for gaining meaningful use. One of the key things is ARA certification of individual EMR products. And then, the next thing is if you're an existing customer, making sure that you're on the right certified version of the product, and new customers, just making sure that you're implementing in time to meet those criteria as well. So we have facilitate either your upgrade or your customer implementation to get you positioned to where you need to be for meaningful use. We're thrilled to be able to also talk about the fact that Centricity Practice Solution version 9.5, which is our ARA certified version, not only received our CCHIT 2011 certification this summer and the preliminary ARA certification that CCHIT offered earlier in the year, but that we also have just passed our CCHIT ONC ATCB. I know that's a lot of initials there, but that's the actual qualification to be ARA certified for a vendor. So we're thrilled to be able to say that we've passed that hurdle as well, and that we're offering you Centricity Practice Solution with that certification and process. So those are some of the things to remember on the road to meaningful use, things that you need to think about as a practice. We're thrilled to be your technology partner on that and really look at ourselves as just that, a partner to provide you with the tools and services to help you really drive your meaningful use projects to where they need to go. With that, I would like to turn it over to my colleague, Kathy Brewer, and she's going to do a great walkthrough for you to show you some of the actual functionality in action when you start capturing the data. So, Kathy, I'll turn it over to you.
Thank you very much, Joanne. I would like to also thank all of the attendees that are listening and participating in the meeting today for giving me the opportunity to present to them the Centricity Practice Solution. Today I'll be presenting some common workflows that occur throughout the day in most practices, but my focus is going to be on illustrating a few of the many powerful features and functionality that can be found within Centricity Practice Solution that can aid eligible providers in achieving meaningful use. It's very much more than just choosing the right product, like Centricity, but it's also about how the practice can actually accomplish all of the tasks to achieve the clinical transformation that's going to be necessary to improve healthcare through effective and new use of technology. So today what I'd like to do is start off with a chart summary for Deborah Tucker. Deborah is going to be coming in today and visit our clinic for follow-up visit for her diabetes and hypertension. And I'd like to think of the desktop or the chart summary as being a electronic table of contents, if you will, into the patient's health record. It's a very high-level overview that also has the ability to have hyperlinks to drill down deeper if more detail is actually needed. I've also come to think of this as a view. I can illustrate how Centricity Practice Solution addresses an incredible number of the meaningful use criteria. For example, we know that maintaining structured data for problems, medications, and allergies for over 80% of your patients is one of the prime meaningful use criteria. So from this one screen, you can see certainly we can obtain that information in a structured format. But if I was sitting in your chair today looking at this, one of the key questions I would be wanting to look and understand better was the usability of this. And so as we move further into documenting a visit, I hope to show you that generating and maintaining these clinical lists, it's not a difficult task because it's really the byproduct of documenting your visits, which is something that you would normally do typically anyway. Now, as we move in and look at some additional features on this screen, you'll notice the drug interaction alert. And I'd like to challenge you to watch for this throughout different locations in the chart. We strategically display this in multiple locations so that it is at the center of care process and aid with that. But in this case, we can see there's very minor interactions for Deborah. She has some alcohol interactions, which is typical. If there was some more critical interactions, we would have different alerts that display in red and yellow to remind us that there are some drug-to-drug or drug-to-allergy interactions that we need to be cognizant of. As we talk about having clinical decision support, we can know Deborah is past due for a mammogram. So again, clinical decision support, having visible reminders, proactive alerts at the point of care will be very strategic in being able to meet the meaningful use measures, which kind of leads me then to our patient banner. The patient banner can be customized and to the practices to contain the information that you find relevant and necessary. In this case, I'll draw your attention to the smoking status for Deborah has not been assessed. More than 50% of your patients over 13 should have smoking status assessed as one of the meaningful use criteria. So what better place than in the banner to have an alert that would remind everyone who actually opens up the chart and looks at Deborah's information to have this reminder readily up front, make sure that we've got that documented within the chart. In keeping with this, too, the check protocols is another alert for me to monitor. And this is letting me know that Deborah is due for some care. And I think that we're going to find that the protocols is going to become more and more useful as we move forward, because one of the meaningful use criteria is that the different practices are able to choose from a menu option 5 measures that they would like to follow. And utilizing the protocols gives you the ability to tailor alerts to yourself or reminders to follow through on those measures. So in this case, Deborah, because she has a family history of breast cancer in her chart. We're being alerted that she is overdue for the mammogram. We want to do those on a more frequent schedule than we would normally do for, let's say, a 40-year-old female. And again, this does not take a programmer to create these protocols. There are things that the end user has the ability to go in and generate those, and I feel will be very useful in the menu options and creating your own alerts in that direction. Patient education is an important meaningful use criteria. We have exit care handouts that are available, and there are over 3,000 very concise and clear topics that can be covered. And so if we choose, let's select one that might be relevant for Deborah, having to do with diabetes, you'll notice that those handouts can be available in English or Spanish, and we can record in the chart that that handout was actually given to the patient. And this is what providing patients with educational materials for the meaningful use. As we preview this, you can see that, again, it's very legible and concise information that can be given to the patient for helping her monitor her diabetes. As we scroll further into our chart summary and looking specifically at our flow sheet view, you'll notice that we are able to also capture in structured data vital signs as well as diagnostic results. And this lends itself very well to being able to come in and graph certain results in helping to maintain and deliver quality care. We can trend and see exactly where Deborah is, if she's getting better or worse with her lipid. I'll draw your attention to the fact that we have the growth chart option. Now, of course, we can see Deborah is a bit outside the range of the 2 to 20 years old, so we don't have data here. But for those of you that deal with the pediatric element, it's nice to know that the growth charts are available. So, again, emphasis on this screen, this one location where you can compile and see this table of content of a variety and an enormous number of the meaningful use criteria. But let's start concentrating now on the usability and how do we maintain and how do we get that data into the chart. So we'll move into our update function and we'll actually start documenting the visit for Deborah. We can see that the large white portion of my screen now is basically where the note will be generated, where it's forms that we may want to use to aid us in documenting that visit. We can see that the nurse or the MA has really already started documenting some of the information in the patient's chart and collecting that data for the physician to review so that the physician becomes more or has more ability and time to focus on the patient and diagnosis and plans versus being a data input clerk. But Centricity Practice Solution has also done something else for us. You'll notice at the bottom of this template that diabetes and hypertension have been highlighted in yellow. And this gives us the ability, the system knows that because those are active problems on our list, that there is a very definite likelihood that we are going to be seeing her or treating her for those particular elements today. So I can pull in a problem specific to the clinical decision support meaningful use criteria because we can view the recommendations for this patient. So by just selecting the view recommendations, I can see that she has a high normal blood pressure, and we might want to consider medical therapy or perhaps encourage her with her lifestyle changes that could help her with her blood pressure control. And she is diabetic, and we don't currently have her on an ACE or an ARB. So again, the point of care, having a reminder about specific information for this patient is also very, very helpful. Vital signs is another area that is focused on very heavily within the meaningful use arena, and so we can collect vital signs utilizing a template. This is just one example of the many templates that we have. We can also collect vital signs pulling information in from digital devices if needed. And as we view the information that the nurse has already selected and entered for us, I note that the body mass index has not been calculated. And just that easily, we now have body mass index, which is one of the call-outs in the vital signs criteria. But we do have additional calculations that we can follow through on too. And as I mentioned earlier, generating and maintaining these clinical lists is not a intensive task that's going to take a lot of the staff or the clinician's time, which is reflected in the bottom portion of this particular template. Normally when a nurse or an MA is working up a patient for the physician to visit with, one of the priorities is to go through and verify patients and allergies. And so they can very easily pull up and see the list without having to go out and look for it somewhere else for any of those particular items. And in the case of medications, in speaking to Deborah, she mentions that she is on a different medication other than just the glucophage for her diabetes. And so with that, we can go out and look at her medical history that has, or medication history, that has come into electronically into our chart from SureScript. So we can see that Dr. Shant, in this case, has prescribed some birth control for the patient. But looking in the bottom grid, we see we do not have that in our chart as a medication that Deborah is on. But we can reconcile that very quickly by simply selecting the medication and indicating that we want to add that to our current meds list. And central windows for us. And not only that, it automatically pre-populates and fills in the information so we don't have to transfer it manually, making it very usable. So we can see the medication as well as the instructions. And in our comments we have that Dr. Shant prescribed this and when it was last filled. But also it's very hard to not see the big red stop sign that we have in the middle of our screen, which is indicative of another meaningful use criteria, which is that interaction checking. So as we open this up, we can see that there is some drug interactions or contraindications for Deborah. In this case, the medication that we just added, or birth control, we can see that there is some contraindications in the presence of hypertension. We can view additional reports on this, and it's contraindicated in severe or uncontrolled hypertension. Well, Deborah's hypertension is in good control and moderate, so we're going to issue an override for this because she has been tolerating the medications before, and with that, we have now changed the red stop sign to a green check mark indicating that it has been overridden by the physician and that we will, of course, continue to monitor that. And as we move down into the prescribing method, notice that centricity included in there that this is historical information. Dr. Winston didn't prescribe Biasmin. It was actually prescribed historically by Dr. Shant, so we can maintain that data. We'll say okay to this, and as we come back to our medication history, we can see the little okay indicating that this has been reconciled, and again, helping us meet the reconcile. Remember I mentioned looking for those drug interaction warnings throughout, so here again, it's displayed very prominently for us to be able to monitor and view. Okay. Oh, little technical difficulty here. So now we're back into our vital signs form where we could continue reconciling her allergies and problems if we chose to. We can also at this point touch base on how easy it is to add problems to a patient's chart. So in this particular case, I'm pulling up an electronic super bill where we can simply come in and select any new problems that Deborah has. So in this case, let's say today she actually has an upper respiratory infection. By simply checking that off, description is now added to her problem list. Another meaningful use measure that's being monitored is being able to computerize physician order entry of medications as well as tests and referrals. So we're going to utilize our CPOE form where we can come in and actually assess multiple problems if we chose to. Today, let's start with her diabetes. And as soon as I select diabetes, we're given a clinical decision support, reminding me again at the point of care that Deborah is not on an ACE or an ARB. Now, we've seen this in a couple of different locations, and I'm showing this purposely in those different locations because you want a system that's going to work for you, not one that you have to work for, documenting and working with your patients. So you don't necessarily have to have it show up in all of these locations. You pick the one that works best for you. And I think that this one is one that our physicians typically like because at this point in time it's also asking if I'd like to go ahead and add that medication. So after talking with Deborah, they decide that it is time to put her on an ACE, and Centricity Practice Solution immediately takes us to a custom list of just the most frequently or commonly used medications by Dr. Winston for ACE. And we're going to put her today on a low dosage. We'll start her off with Altase. And as soon as I select that medication, we're presented with another little red light or warning. You can see that Altase is not on her formulary. She has consolidated healthcare company insurance, and that's not on that formulary. But there are multiple alternatives. So I can, at this point, choose an alternative, come in, and let's put her on Prinavil instead, and we'll say okay to that. And so now we have the green light. This is covered on her formulary. We may want to go ahead and enter in her instructions and add in the quantity, and we'll give her one refill. And because Deborah would like to stop off at CVS on her way home and pick up her medication, we want to come in and choose that, and we're going to electronically send this prescription over to the CVS pharmacy. Notice our prescribing method in this case has now changed. Step back and really look at this screen, because what has happened is this one function has given us the ability to address three of the very large, major, meaningful use criteria. We've seen formulary advice that has come in. We also have the counter indications or interaction advice, and we've e-prescribed the data. But is there places that we could do some additional meaningful use criteria? How about if we select that we want to give her some more patient education? By selecting print the patient handout, we can print a Metaspan handout on the Prinavil that can be printed at the nurse's station or at the front desk that can be given to the patient as she's checking out today. But if we also take a look over to the left-hand side of this screen, some additional information, again, maintaining those lists. If at any point in time we needed to add a problem, we can certainly see the problem. We could add one. We can also review her allergies as well as adding a new one if the need presented itself. And we do have some demographic information along with vital sign data and lab results. So it's important to note that in order for the data to be meaningful, it needs to be presented to you when you need to have it, when you're doing tasks that requires that data. And I think you'll see that Centricity Practice Solution certainly meets that bill. Now, as we're back into our CPOE form for assessment, we see that the Prenaville has been added, and we're given another little alert that she might also benefit from aspirin. At this point, we're going to say no, that we don't want to prescribe aspirin for her today, but we can also have an option to enter in a contraindication to aspirin so that it will not give me the same warning the next time or same alert the next time that we're visiting with Deborah. And then if you remember earlier when we were talking about the smoking status, I mentioned the fact that there may be a location where it's a lot easier to be able to document and deal with that. Here's that particular spot. Notice that we're now being notified by Centricity Practice Solutions that we've not assessed or documented her smoking status. And so it's saying, has she or is she currently smoking? So I can say no. And Deborah tells us that, in fact, she has never smoked. So we've documented that data in the chart that easily and put us that much closer to meeting the meaningful use measure for smoking status. And then last but not least, as we finish up assessing our diabetes, I'm now being informed that she is overdue some care for diabetes. And I am given the option to review what that particular protocol entails. So for diabetes, our practice has set up a protocol for certain tests to be done on a certain time frame. So we can see when the next ones are due, as well as those that are currently due right now. And then I'm also afforded the option to order those. And I'm going to go ahead and say yes. In particular, I noticed that we need the dilated eye exam. So we'll say yes. And that easily, we have added the orders to be processed, as well as adding them into her chart for documentation. If I come out to my new orders window, because I do want to monitor or go through the eye exam that we need to refer her out. There'll be some coordination that we need to do. And when I come in and look at this, I notice immediately that Donald Reese at Northside Ophthalmology is the preferred provider for from her insurance company for conducting eye exams for their patients that have their coverage. So we'll make note of that, and we'll say okay. And at this point, we could continue on with doing the assessment and plan for her hypertension and for that upper respiratory infection. But in the interest of time, I'm going to go ahead and let's close our document, and we're going to end the update and sign off. Now, what's going to happen is a couple of those items, the handouts that we suggested printing, is it's going to give us the option to save those since I don't have a printer. But it's also going to be electronically sending out the prescriptions as well as any orders. And then we start. An additional meaningful use criteria is that clinical summaries for each office visit is provided to your patients within 3 days of the visit. So we can do this right now by simply saying we want to print out this selected document, and instead of printing it, I'll preview it, and this can be printed again at the nurse's station or at the checkout window so that we can give this clinical summary of office visit to the patient as she's checking out and certainly meeting within that criteria. Now, we could, if we chose, we could mail this to her, snail mail, or we could also email the information if that was the preferred method of contact that Deborah actually has listed in her chart. So now we've covered into the system, so let's talk a little bit about the communications between other eligible providers as well as with the patient. So we saw that we're actually going to be doing a referral for her eye exam. So I'm going to come into a new screen, which is the physician's desktop, and think of this as the physician's dashboard, Dr. Winston's dashboard, that gives him a listing of all of his appointments as well as any inter-office communications with other staff members regarding patient care, or documentation that has come in that's waiting for review. It may be lab results or consult reports that have come in from other providers that's waiting for Dr. Winston to actually review and sign off on those. But for today's presentation, we're going to be focusing on the actual communication as Dr. Winston. Normally it's open for me. It's actually timed out on me, so we'll log in again. And at this point, we can say we do want to go out, and we're going to send to Donald Reese, and this is going to be a referral for Deborah Tucker. And we may want to attach some information from her chart to today's visit. So in keeping with this, we'll log in and actually pull in a list of the documentation, lab reports, office visits that are available in Deborah's chart that we could send to Dr. Reese to aid him in his evaluation of Deborah. So I do want to, let's say, include today's note, a CCD. And this is one of the formats as outlined in meaningful use as being able to exchange information with other physicians as well as patients for transitions of care and referrals. If we want to view the CCD, so you can get an idea of the information that's going to be going out to Dr. Reese, we can see we have some demographic information, but we can also come in and review her problems. We have a table of contents, if you will, for her diagnostic results, so we can send him her values for all of her labs and diagnostic reports. We can see the medications that she's on as well as advanced directives. So Dr. Reese, if he has an electronic medical record that has the ability to pull this in to the electronic chart just as Centricity does, then he could, or his staff members could take this CCD and electronically pull that in and populate the chart for Deborah before he starts seeing her, so that information is not having to be re-entered. And that is, of course, a relief for Deborah. How many of us get really frustrated when we visit different physicians and we're having to fill out the same information over and over again. So given all of this information, we've attached our documents, and we're going to simply send this information now to Dr. Reese. So that shows communications with providers, but let's talk a little bit about how we can communicate with our patients. So we're going to log in to the Centricity Patient Portal, and we'll log in as Deborah Tucker, and giving her access to view information in her chart. She may want to come in and create and view a CCD herself, and you'll see it's very familiar, very similar to what we just looked at. So she too has that information that she can carry with her or present to other physicians if she chose. She can also have information, secure emails coming in from the physician, so we can see that those lab results, some of those lab results that we ordered have come in. We're going to kind of jump fast forward in time, and Dr. Winston's office has sent her information regarding her lab reports or information regarding the need for her to fill out her blood glucose journal. Yes, we want to look at her lab reporting, the lab reports, as well as being able to see the actual report itself as it would come in from the reference lab. So given this information, we've covered quite a bit of data so far, but one of the areas that we want to focus on is the fact that once you've captured all of this information and you've got the meaningful use measures ready from your practice, you want to be able to demonstrate the ability to give those achievements or demonstrate the achievement will be the actual next step. So, in 2011, as mentioned earlier by Joanne, I'm sorry, I've got Deborah on my brain right now. In 2011, the mission will most likely be accomplished by having the practice actually log in to a CMS portal and through self-attestation document that they have met the requirements. But then in 2012, we know that the submission requirements will be electronic and more than likely will follow the current measures that are used or the current format used for PQRI submission. With GE's quality reporting services, we know that we're able to extract information from the patient's chart, and along with a long-standing relationship that we have with the Medical Quality Improvement Consortium, also known as MQIC, you can rest assured that you're partnering with a company that has a long history of tracking and reporting on quality measures. Centricity Practice Solutions captures the data as you enter it, as we've just seen, and then we can let the quality reporting services pull all of that data together across your entire practice, scrub that data so that we are certain that we're comparing apples to apples. Centricity Quality Reporting Services also will apply to many of the different quality programs already. We've been submitting to PQRI, Docket, and NCQA for quite some time. So meaningful use measures and quality reporting will be an additional type of quality reports that will be supported by the quality reporting services. The ease of use and clarity of some of these of generating these reports is a design goal within GE as we create the meaningful use reports, and very important reports. Next slide, please. GE's quality reporting services also has some trending functions, actually very extensive trending functions. And if your practice is also a member of the Medical Quality Improvement Consortium, you can be provided with measurements and benchmarks on how your location is actually doing across the, and in comparison with other practices across that consortium. So our customers may also choose to create their own meaningful use reports based on internal reporting tools that they have. And as mentioned earlier, GE will be happy to assist them with some templates and some guidance in crafting those their own report strategy, if for whatever reporting services. So in closing, I'd just like to point out that Centricity Practice Solution is able to not only ensure that you're capturing the right data, but with the quality reporting services, you can also know that you have been provided the tools that will allow your organization to actually measure that progress on all of the meaningful use measures that you choose to. So with that, I thank you, and we'll turn the presentation back over to Russ.
Great. Thank you very much, Kathy, for a great overview, and thank you, Joanne, as well, for a great introduction to that. We will have some time for Q&A next, and I also want to mention a few resources that we're making available to you. We had quite a few questions over the chat feature that were submitted, so we'll try to hit the most common ones with the 10 minutes that we have left. Before we do that, a couple of resources that may be helpful to you. We have a screenshot that you can see on the screen of a survey that we made available. This is a meaningful use readiness survey that is going to be particularly helpful for existing Centricity customers to see where you stand today in your use of Centricity and how else GE can help you optimize your use of our EMR solution for meaningful use and really much more than that. This is just one of the types of resources and services that we are making available for current and future customers to help understand and prepare for meaningful use. It's certainly a very helpful one that many customers have taken advantage of. So if you have not done that, I encourage you to take the survey. It's a rather in-depth and thorough survey. You can see the link there, and it's also in the same lines that's available to current customers, and if you're a new customer, that will be available to you once you've gone live as well. About 3 to 6 months after you've been using Centricity Practice Solution, we have a consulting service that's available. If you determine that you need additional help, you can contract with our EMR consulting team for a special meaningful use assessment that will help you understand your progress toward demonstrating the criteria you saw today and many others. So if you need that service, GE Consultants will assess your practice, your use of Centricity Practice Solution, including things like decision support, e-prescribing, and how you're incorporating those into workflows, and also things such as Clinical Messenger and Patient Portal, which you saw today. At the end of that consulting service, your practice will receive an evaluation, or you'll receive some help in creating an action plan for your practice to take advantage of those. So those are some of the ways beyond just the solution itself that we're committed to helping you truly be successful. A couple other resources just to mention is you'll see some links on the screen. There is gehealthcare.com/meaningful use, which is a great entry point for any questions that you have related to meaningful use. I encourage you to refer to that. And then there's also a free white paper that is available. The link is on the screen and also in the chat feature. If you want to learn more about the HITECH Act in general, meaningful use, the incentives that are related to that, and how we believe that this is an opportunity for your practice to strengthen your foundation for true clinical transformation, then I invite you to download that white paper. It's called Beyond Meaningful Use with GE Healthcare, and it talks about Centricity Practice Solution as well. So with that, we do have some time for a few questions. And Joanne, I'll begin with a question for you. Can you talk a little bit more about certification? We have some questions about the different versions that are certified, but talk a little bit more about what certification means for Centricity Practice Solution and our customers.
Okay, sure. Happy to, Russ. One of the criteria for achieving meaningful use to apply for the incentives is that you must be using a certified EHR product. So the question then came down to CMS and their various organizations as to, how do you certify that product? So amongst other organizations, CCHIT was chosen as one of the organizations that could certify, an application or a series of applications for certification. So it's important that you do use a EHR solution, and again, CCHIT is one of those. And again, we did achieve for Centricity Practice Solution that official ARA certification just a few weeks ago as well. So it's something that you do need to bear in mind as a customer, as a prospect, that you're using a vendor that is certified by one of the approved certifying bodies. And specifically with CPS, with Centricity Practice Solution, it's our version 9.5 that is the certified version that meets the criteria that the ONC outlined as necessary for those certifying bodies. So use a certified vendor, and if you're using Centricity Practice Solution, use version 9.5, Russ. That's it in a nutshell.
Great. Thank you, Joanne. We had several questions, so hopefully that helps answer some of those. Joanne, another question that's related to the certification that you just spoke about and the clinical quality. Can you talk a little bit about where Centricity Practice Solution stands towards certification for the 44 different quality measures?
Yeah, sure, and happy to address that one. And this is one of those areas that is a little bit fuzzy, so I encourage folks to download the white paper, Russ, that you just put on your screen, because we do discuss this in a little bit more detail there as well. But to make it fairly brief, the meaningful use measures are divided into a core set of measures and a menu set of measures. And then there are some quality measures on top of that. So the core set, and again, you'll be able to find a list of what those are specifically, are the measures that you must be able to meet if you're an eligible provider. The menu set is, Kathy referred to this earlier, you select 5 of 10 possible menu set criteria. They're giving you 3 core quality metrics that you need to follow, and then they're giving you a list of 38 other possible metrics, and from that list you select 3. So again, there's 10 meaningful use core set criteria. You pick 5 out of 10 possible menu set criteria, and then you have to have a total of 6 clinical quality measures that you're measuring. 3 of those are given to you, and 3 of them you pick from a list of 38 different possibilities. So I hope that's pretty clear. You do have some flexibility, and this is, the ONC is sort of replying to feedback that they wanted to give, people's practices some flexibility with what quality measurements they actually chose to track.
Okay, great. Thank you, Joanne. Kathy, I do have a question for you. We had several specific questions. We unfortunately can't get to all of them. This did come up about how a provider can determine which documents the patient can have access to, and also which things can be made available to complete from home. So can you talk a little bit about some of that functionality?
Sure. For those customers that are on the line, the patient portal, the forms that the patients are afforded to fill out at home that can be electronically sent into the chart is very similar to the way we work with our templates and encounter forms. They can be designed by the practice. So if you have favorite new user forms, those can be transferred into an electronic format by you, very similar to the way we use some of our form development tools, and then set into the portal so that the you can direct new patients or existing patients to complete those. And there's a wide variety of existing ones. In fact, doing things like putting their blood sugar journal online and sending that information. And the beneficial feature to that is the fact that that data can come in as structured observation or structured data, so that it pulls in and can be displayed in the flow sheet for the trending if you would like. So very beneficial in that respect. With regards to the documents that are available to the patient from their chart, actually documentation would be selected by the staff or the physician as far as what they wanted to send over to the patient. So they can't go in and pull out all of that documentation. They have to request it, and obviously there's a release of information form that they can fill out, and that's what triggers. I saw one of the other questions, I think, was, what triggers the count to show that you sent this information, and filling out that form for that, and it's feeding that fact that that was done to a discrete data element that can be counted. Now, with regards to the CCD, that is a standard format, so there is really no control over what's demonstrated in that. I scrolled through it so you were able to see things like the vital signs, the lab results, and things like that. But keeping in mind, too, that results that are abnormal or out of range will be reserved until the point of signature. They're not going to automatically go out to the patient. So if there's certain information that you feel more comfortable that you present and be available to discuss and explain in more detail than getting something in an email, then you certainly have that ability as well.
Great. Thank you very much, Kathy. And we are at the top of the hour. I'm going to go ahead and ask one more question for you, Joanne, because we did get several questions on this topic. So briefly, can you talk a little bit about CCC forms? Several people were asking about Kathy's use of those. Do people need to have CCC forms, or what's optional and what's required for them?
Sure, Russ. Happy to address that one. We intentionally tried to design all of the ability to track the quality metrics and the other metrics so that the use of the CCC forms, that's an additional a specific content package that we're able to provide is not really required. So if customers choose to use those forms, that's great. They certainly can. Many of our existing customers choose not to use those forms and have created some of their own noting templates and things like that, and that's fine as well. So they're not, it's not required that you have that entire package in order to meet which quality metrics it is that you want to measure, and have ensured that you're using the right noting templates that you need to in order to capture that. So really it depends on what quality metrics your practice is tracking and whether or not your documentation templates are actually capturing that data. That's the most important thing.
Okay, great. Thank you. And hopefully that answers many of your questions that you had today. We are at the end of our time, so I would like to thank Joanne and Kathy for being our speakers and our presenters today and for doing a fantastic job. And I'd really like to thank our audience for you for taking the time to join us today. We know that you're busy, so we hope that this was a valuable part of your day. And we'd be happy to follow up with any questions that you may have going forward. As a reminder, we will share a copy of today's program with you by email, so be looking for that. And if you're interested in downloading the brochures up with meaningful use, the link is at the bottom of this slide, and it was also put in a chat feature, so I encourage you to take a look at that. Wherever you are, we are ready today to help you prepare for meaningful use. We've got solutions like Centricity Practice Solution that are certified and well-equipped to help you do that, to take advantage of not only the meaningful use criteria, the many other benefits and efficiencies that you can achieve for your practice and ultimately your patients. For our current customers, we encourage you to contact your sales representative, your value-added reseller, or your account manager soon if you have not done so already. You will want to begin conversations about your upgrade planning needs. And if you do not know who your account manager is, then feel free to send an email to the address on the screen, which is EMR-AM. That are listening today, we are very delighted that you've joined us. And please feel free to contact us further at emr@ge.com, and we will be glad to speak with you. I want to thank you again for joining today. This does now conclude our program. Have a great rest of the afternoon. Goodbye.